Hello, I'm Dr. Nick, here to talk about better health. A recent editorial in the Annals of Medicine by my friend Dr. Eric Topol and his colleague Dr. Pandey caught my eye. Dispense with supplements for improving heart outcomes. In the United States, nearly 75% of people are taking some supplement or another, with the supplement market set to reach $300 billion in the next few years. So there's a lot of money at stake, and most of it's yours. You only have to take a look down this supplement aisle of any pharmacy store to get a sense of how wide the range of options are, the choices available, pills you can take, fill in the gap for health benefit, cure for disease, aging, you name it. In many cases, the price and packaging are put in such a compelling way that you're thinking, well, it's only a few cents per day. There's no risk. I'm taking something my body already needs and it's in my diet. I'm probably better off taking it just in case it's good for me and my health. And if it's not, no real harm, and it doesn't make a big dent in your personal finances. Well, current data suggests it averages to about $100 per man, woman and child per year. To put that in terms you might hear from those very same companies trying to separate you from your money, that's less than 27 cents per day, or less than the price of a cup of coffee. Irrespective of the costs, are these chemicals, and yes, they are chemicals, especially since the form they arrive in are artificially created, do you need them? And should you be taking them? Once again, the science offers some guidance, but as usual, it's not clear nor certain, and the guidance may change as we learn more. More on that later. The authors in this case reviewed several articles, including a pre-release version of an article published concurrently in that edition of the journal, covering 277 trials and nearly 1 million people, for which those authors could only find one dietary modification that may offer some benefits for those who have a low salt diet. But this water is muddy even in the case of that effect, because it depends on your blood pressure. If you suffer from hypertension or high blood pressure, this low salt diet had no effect, but it did have an impact on people with normal blood pressure. Other trials fail to explain what may be going on with that, even showing an opposite effect with cardiovascular outcomes, and notably the fact that Hong Kong women who have an average lifespan of 87.3 years, one of the top life expectancies in the world, but they consume 8 to 9 grams of salt per day. The US guidelines for salt intake per day is less than 2.3 grams. As we deepen our understanding with data, we continue to expand our understanding of natural variation in humans. In fact, salt, sodium or salt sensitivity, probably has one of those spectrums, and there's early evidence to suggest that there are people who are opposite of salt sensitive. They appear to need large amounts of salt in their diet for them to be normal. The other finding on supplements was equally disappointing, with the possibility of the omega-3 fatty acid having a salutary effect on heart attacks, and folate supplements having a salutary effect on strokes. Digging into the source data and the trials suggests there may have been geographic reasons for the folate effect, as the population was from China, where folate-rich diets are not routine. So what should you do based on the science? It's easy to get sucked into the marketing and the business and the statistics, and they demonstrate to you on the bottle of this supplement suggests that you need to do something, and for the vast majority of people who are lucky enough to have a good varied diet filled with a range of nutrients, our bodies probably don't need these supplements. They're unnecessary, and your money would be better spent elsewhere. Perhaps buying fresh fruit and vegetables. Holding off on taking any supplements and dietary modifications seems the wisest course. unless your own individual circumstance, medical history, clinical advice or findings inform you and your partner physician otherwise. I've gone through a rigorous personal review of my own health and continue to update my personal dietary actions and supplements based on individual circumstances for me, and you should too, in conjunction with your healthcare specialist, perhaps making good use of the time you have during your annual physical to discuss, review, and adjust your own plans. If you like this video, please subscribe to my channel and drop me a message if you consider sponsoring more educational videos like this one. Send me your feedback, thoughts on how I can improve things. Meanwhile, you can always read more from me, Dr. Nick, at incrementalhealthcare.com, where you can find more insights for smart technology for better health and outcomes.